Well, yes, we had an interesting conversation with the management of Fortis. While the key reason for this conversation was basically acquisitions picking up within the entire hospital space. We'll get to that in just a bit. The more important point in terms of the conversation is what is taking place when it comes to the Supreme Court verdict on the IHH open offer, which was expected in the month of August. Remember, it's been pending all the way since December 2018. Now, the company says that the hearing on the open offer has been completed. They are awaiting a judgment. The judgment, in fact, on the open offer could be possible within this month itself. So within the month of September. They had indicated that it would probably come in August, didn't come in August. So maybe September is when we could hear something on the open offer. There is a judge who is expected to be retiring as well. So maybe the possibility is that we could probably hear the final verdict on it. IHH, are they probably looking to exit Fortis considering the amount of uncertainty, the fact that the open offer has been delayed for so long? No. The management says that they are committed to Fortis. They are not looking to exit Fortis. And internal expansion also has not been impacted. The net debt for the company stands at around 500 odd crores. In terms of acquisitions now within the hospital space, remember that there have been 3 deals worth 700 crores just in the past 1 month. So deals have been struck by the likes of Apollo Hospital, Krishna Institute of Medical Care, as well as Narayana Health. Fortis says that they are in a position, in fact, to go for a massive expansion at this point in time. They are looking for assets to acquire, have a good amount of brownfield expansion on the cards, which is adding 1,500 to 1,700 beds, and they will look at acquisitions in certain clusters as well going forward. Remember, most hospital companies have said that it is a plug and play kind of impact, focus on acquisitions which are a strategic fit, either therapy-wise or either geographically. We did speak to the management of Fortis earlier in the day, like we mentioned. Listen in to what he had to say.
The hearing was actually completed last year, so we have been waiting anxiously, but we hear that the judgment is imminent at any time. Within this month is what we are hearing from our lawyers. So we are just keeping our fingers crossed that it should happen this week or the following week. Our metrics are very good, and we are in a position to go for a massive expansion, and we would be looking at potential targets to acquire as well. We have the capacity to do further mergers, but we would go strategically, first in the areas where we already have our presence, and then secondly, if there are any opportunities where a preformed cluster in an attractive location and at an attractive valuation is available.